Welcome to the Ohio Health and Wellness Hospital training for Paragon 14.0.1 upgrade and the change from Web Station for Physicians to Paragon Clinician Hub. There will be an icon as a shortcut on your desktop. When you double click the icon, it will launch you into the Citrix environment. You will then log into Citrix, select Paragon Clinician Hub, and then you will receive this login screen. You will type in your provided Paragon username and password, and that will log you into the system. Once in the system, if you're familiar with Web Station for Physicians previously, you will see that this screen looks completely different. So we will take this step by step and break it down. Across the top, you will see this still defaults to your Census tab. That's the same. You will also see a Schedule tab. This is where you would see the physician schedule. If you're a resource and resource scheduling, such as surgeons, you can see your schedule for the day. Deficiencies is your medical records deficiencies, and you can click on MPF deficiencies to go in and view those from this bar as well. Across the top, you also have a refresh icon here, very similar to Web Station. You have an appointments schedule here, which we do not really utilize this feature. You have access to referential content and patient education utilizing Truven. If you select the education icon, you'll have to decide whether you just want general information for the patient or if you want to do patient-specific education. And then you can go into the search and things from there. This personal web link is where your URLs tab was in Web Station for Physician. This is now personal links. You can come in here and you can manage as many as you would like for yourself, up to 24, and set as many websites as you want for your favorites. Across the top here, it will let you know that you're the user that's currently logged in. If you're also curious as to where the super user authority lock is, it is underneath this drop down now on the right. This would allow you, especially for physicians, if you needed to get access to a chart and another user was in the chart, you would have this super user lock authority in here that you can select. The question mark is the help guide for the application. If you need any help, you can click on that. The guide is very user friendly. And then this is an application lock. If you wish to walk away from your computer and you need to lock your screen, you can do so by selecting this. Then you'll simply have to come back to the screen, type in your ID and password, and it will allow you back in the application. When you're completely finished with Clinician Hub, then you will want to log out utilizing this button right here. What this does is it checks for any open documentation or pending orders for the patient. And it also just kind of gives you a double verifier on those things. It also, if you would try to go launch the application again immediately, sometimes it won't allow you to if you do not close the application correctly. Please stray from using the big X to close the application. What you will see on the left side here is we now have save filter options. When you first log into Paragon Clinician Hub for the first time, then it will automatically default to the My Patients filter. This is very similar to the Group of My Patients filter that the previous physicians were used to. So this would display in your census your Group of My Patients filter. You have the ability in here to customize filters, and that's also very beneficial if you take the time to do so. You can sort by all these options, including facility, group, location, inpatient or out, problem, sex, race, age, patient type, status, admission status, and your relationship to the patient. To create a new filter, you simply select your criteria. When you've set all the filters you want, you select Save and name the filter whatever you wish. Click the Save. You will see now that that filter populated into my Save Filters icon. You also have the option at this point as well to save that filter as a default if you choose. If you wish to see your other filters, you simply click the down arrow, and here are the rest of your filters for the patients that you selected. You will also see across the top here you can sort by location, name ascending, name descending, or any of those things you wish for your census here. You can change your row limit, which is how many patients display in this row or on your census, between 200 and 800 max. You also have the ability to change from the list view, which is this view here, to the card view, just a different way to view the patients. If you're on the list view, you will also see you can expand the card, and by expanding the card you will get some additional patient information, including the most important one, which is PCP. You will also have the ability, if you expand the card, to add a patient to a collection by selecting this button, which we will talk about collections in a moment, view a patient schedule, or you can do, if you have the ability and it's set up on your security, to pre-reg a patient to allow you to put in orders on a patient in a pre-reg status. Creating collections is a new enhancement in Paragon Clinician Hub for version 14 that allows you to put patients together and keep track of them in a collection even after they're discharged. Adding patients to the collections and removing them is a manual process, so it's important to notate that. To create a collection, you start by going up to the Collections drop-down and select Create New Collection. You then name the collection, whatever you wish to call it. In this example, I want to follow up on some patients that I'm putting in labs that I know will not be resulted until after the patient's discharge. So I'm going to call this collection My Discharged Patients. I'm then going to click the Save icon. I created my collection. Now, when I'm in seeing my patients, I can then add them to a collection. Let's say, for example, I wanted to add Stork Test here to my collection. I would expand Stork's card, and I would click the plus sign next to Add Patient to Collection. I then would select the collection I wish to add the patient to, and I would click Add. It would tell me Success. Now, even after this patient disappears off of my census, which is 24 hours post-discharge, I then want to follow up and see if those labs were ever done. So to do that, I can come up to my collection, go to my collection that I created, and then I would select that patient from that collection. When I'm done and I no longer want that patient in this collection, I then can click the expanded card again and remove the patient from the collection. It'll ask me if I want to remove, and I simply click Yes, I want to remove. And the patient is removed from the collection. One of the other things that can be done if I'm on my census screen is I have a Select an Action drop-down. There are two reports in this drop-down that appear that are new for Paragon Clinician Hub. The SBAR report, and in this situation I don't have a baby, but also there's a mother-baby report that shows up here as well. The two reports I want to talk about are the SBAR report and the rounding report. The rounding report will pull whatever patient filter you have selected that generates your patients here, will pull that information into your rounding report. The SBAR report will also do the same thing. The SBAR report is a new report for PCH that's very nice and has some good information about the patient. But you want to remember that, for example, if I have 25 patients in my census filter, it's going to take the time to generate 25 SBAR reports. There's not any way to individualize it unless you're just searching for a patient and you find only one patient in your census. So keep that in mind. Across the top here, you will also see the patient search bar. You can search by a patient's last name and first name, medical record number, or visit ID. When you start typing, those patients that meet your criteria will show up. You want to verify that you have the correct patient and date of birth before you launch into the patient's record. To launch into the patient's record from the search, you simply click on the patient's name and it will launch you into the record. Over on the right side here, we have the physician work queue, which is what replaces the action list from WSP. In PCH, it's called the physician work queue, and we will talk about that. Now that we've talked about filters, how to find a patient, now I'm going to show you how to launch into a patient's chart. You simply click on the patient's name, and you will launch into the chart. All the information that shows up on the left side of the screen is patient-specific information. Across the top, you will see some of the tabs that you're very familiar with from WebStation for Physicians. And then now, the nice thing in PCH is you now have an overview of the patient in a glance. You will see you have categories of eyes and O's, results, vital signs, and medications. If you wish to find out more specific information about this patient, you simply, on this particular area, click the arrow at the top right, and that will launch you directly into that flow sheet. On the left side here, all the information you were used to seeing for the patient, this is the patient-specific area, you were used to seeing it across the top on WebStation for Physicians. This would include implants, code status, education, medications. All of those tabs now show up in this drop-down called the patient work queue. You can select any of these things you wish. You also have the ability to edit them or do any of that like you did in WebStation by simply clicking the category and going to Manage. It will launch you into that application. Come down to Add and follow the same procedures that you already knew how to do. On the Overview tab, you will see the 4 main flow sheets: eyes and nose, vital signs and measurements, results, and medications and IVs. You will also see the orders non-medication at the bottom. If you see information in any of these boxes that you wish to find more detail on, you come up and you launch into the specific flow sheet for that area. You also can collapse these fields so that you don't see them if you choose to do so. On the vital signs, you will also see a plus sign here that allows you to go in and add a vital sign entry as a APP or physician. Simply fill in the field that you wish to fill in, click Save, and the vital will be added to the patient's information. The Ordering tab is what is replacing the CPOE tab in WebStation for Physicians. Once you click on Ordering, you will see that everything is the same as it was in WebStation. You have your order queue, search, favorites, and MedRec. If you have favorites saved in the current 12.1.3 environment, those favorites will carry over to the new 14 environment when we upgrade. When you come into the order queue, you will see all the orders that have been placed for the patient. You can choose to sort them however you wish and view that information for the patient. To add an order to the patient, come to Search. Search for the order that you wish to input. Select what applies. Edit the order for the correct frequency, date, and time, and then save at the bottom. We do have order sets built in the system for specific departments. If you wish to see a list of order sets, change the All drop-down filter to Order Sets. And then search. And this will show you the list of order sets that are currently in our system. You can choose to use any of these if you are a physician or APP that you choose. When you find things off of the search, you can add them to your favorites. One of the things that was improved in 14 was now, instead of having to remove an order set that was updated or an order that was updated in the system and having to search and add it back, if anything's been changed with the order, you can simply update it. Medication reconciliation is where you would come to do a MedRec, admission, transfer, discharge, depending on what you're doing. When you do a MedRec, every line item has to be addressed. If it's a home medication that you do not wish as a physician to change or do anything with, you continue to defer that medication until you do the discharge MedRec. On this side, you'll see little indicator icons. This is a house symbol, which stands for a home medication. If a medication was ever wrote through our prescription writer system, you would see a purple RX. And if they're inpatient medications, they would not have a home symbol or a purple RX. They would just be blank. Once you have addressed every line item on the MedRec, you will see at the bottom left that the Complete button is available. You will click Complete, tap your Imprivata badge, and those orders will go through for the patient. The admission, transfer, and discharge MedRec process is the same. The next tab over is Prescription Writer. This is the exact same as it was in the previous WebStation for Physicians. Once the application opens, if you want to add a prescription, come down to Add New. If you get a prompt that you should incorporate this or amend the discharge draft, you definitely want to do this. You want to make sure that that record in Paragon stays up to date for the patient. And by amending the discharge draft, this is what controls that. For the purposes of this video, I'm going to say no. What it will do is display home meds on the right side here, so you can choose to prescribe something from a home med, or you can search for a med in this field depending on what you're looking for. I'm going to renew this prescription for Tylenol. Hit renew. It will drop it back to the pending tab. I will then pick how many I want to dispense for how many days, and then if I want to have any refills. And once I get a green checkbox here, that means I'm good to submit this prescription. If I wanted to edit additional information in this prescription, I can click on it. The prescription pad will pop up and I can edit any of the fields that I choose to do so, or make specific comments to the pharmacy. When I'm done, I'll select Save. I will add new for any additional prescriptions I want to add. When I'm finished, I will click Continue. Now, we do have the ability to e-prescribe at this facility depending on the physician that you are. If you're a full-time physician, or if you're a full-time advanced practice provider, you will be able to e-prescribe. The nurses will come in and put the preferred pharmacy. All you will do if you wish to e-prescribe is put a checkbox next to use this method for all prescriptions. That will bring this pharmacy from the left to the right. And then you will change this print to transmit. If you do not wish to e-prescribe, all you have to do on this screen, it will default to print. You want to make sure that your correct printer is selected at the station where you're closest to. And then you will just hit submit, tap your badge for dual authentication, and then those prescriptions will print at the printer. The next tab over is flow sheets. You can launch directly into the flow sheets from the overview tab as I previously showed you, or you can come to the flow sheets tab and choose which flow sheet you wish to view. You can view the MAR, results, eyes and O's, or nursing, and then eventually we'll have some customized flow sheets available as well. The good thing is you can also come in here and change your time span. You also can go to a specific date and time, or you can type in a specific lab value and then hit enter, and it will take you to that specific lab value as well if you're on the results flow sheet, or even in the nursing if you're looking for something specific. Documentation. The good thing about documentation now is it opens in a separate window, so if you have a dual screen, you can move documentation to the right and have your patient information still on the left, so you have that information right in front of you and you're not bouncing back and forth. You will see it stays the same: documents, search note templates, and favorite note templates. Documents would show all the documents that have ever been done for this patient in Paragon. And you can view the documents by simply clicking on it. The document will launch and you can view that information and close it when you're finished. To create a document on the patient, you start by going to search, select the appropriate note, or search for the name of the note that you wish to find. Click on the note that's appropriate and it will open the note and allow you to fill in the fields. You can also flag these like you can orders and add these to your favorites list, which would then populate them to this list right here. So when you come in a note, everything's free text, checkbox, sometimes it's circled, sometimes it's a diagram, depending on what's going on. Come through the note, fill it out. A lot of the information will pull from the patient's profile done by the nurse. So problems list, allergies, home meds, as long as all those things have been completed, they will automatically pull into this note for you. Vital signs will as well. Physical exam you will fill out. Laboratory data will all populate. Micro will not, pathology will not, and radiology will not. So if you want those information in your documentation, you'll need to copy and paste that information into those fields. Problems and procedures will come forward automatically, and then you'll fill out your assessment plan. At this facility, you don't have to worry about billing codes. We have coders and billers. And then you will sign the note when you're finished. If you're the attending physician, it will say click here to sign on this line. And then it will, at that point in time, it will pop up and ask you if you want to fax the document. If you want to fax the document, you simply type in the name of the provider you want to fax to and hit OK. If you do not wish to fax, you can skip. If you opened a note in error, you can click the invalidate icon on the top right. And then you can select OK, and that information will disappear, and that document will disappear. If you have signed a note and you need to add information to it, you then can create an addendum. To do an addendum, you click on the note. In the top left, you'll select the appropriate addendum template. And then you'll select the Create Addendum button next to the drop-down. And this will allow you to add an addendum to a note. You then will need to sign the addendum as well. That is the search functionality. If you go to your favorite note templates, any notes that you've saved from the search will show up in here. Schedule, this would be your schedule, or your patient schedule, and physician schedule on this side. This is only if you are a resource in resource scheduling. It will not show you anything else besides what's attached in resource scheduling application in Paragon. Reports, you can come to reports to find a couple different reports. Charges, patient profile, history, and the ED summary if your patient was in the emergency department, and a med rec report. In the More drop-down, this is where you're going to find your medical record deficiencies. Also, again, you can get to it from this tab up here. You're also going to find the medical record itself if you're looking for old patient documents and that type of stuff. And then you can also bulk sign off your orders from here, which we haven't talked about the work queue yet. If you wish to get to a different patient and you're finished with this patient, simply click the Census tab button on the top left, and it will take you back to be able to search for a different patient. The other big upgrade that came in 14 was now instead of having an action list and order sign-off tab on the top, you now have a work queue on the right. You saw me expand the work queue to make it where you can see it. Traditionally, it stays in this view, so it's out of the way. When you open your work queue, you'll see two different columns. You'll see a task and you'll see an alert. And then they also can be combined in the all column. You want to make sure that your view is to active because you have the option of viewing things that you've already signed off, which is where historical comes into play. An alert would include things like lab results that might be critical or abnormal, or it's a discharge result. It also would include order alerts, rules engine alerts for things like VTE and code status for you to acknowledge. A task would include things that you need to sign off, like documentation and orders. So you'll see I come into my alerts and I have alerts for assignment changes. We will not be utilizing this function, but we will see there's a rules engine alert here that says missing prophylactic VTE order. I can pull that up, view the information, and at this point in time I can put a patient in focus to go order that on that patient, or I can reject it as well. And then if I hit reject, it asks me why am I rejecting this, and I can select the correct appropriate information. And then I can submit. And then that alert will fall off of my list. If you get a critical lab in here, it will show up red, or an abnormal will show up yellow as a quick indicator. Your tasks, again, like I said, are things like sign-off orders from verbal and telephone or documentation. So I'd come to there. I can still bulk sign off. I have a bulk sign off option here. But remember, if it's documentation, it can't bulk sign it off. But if I wanted to bulk sign, I just click there. Select my appropriate fields. I want to sign all these off, and then hit sign off. And then they would disappear off of my action list. And that concludes the basic physician and advanced practice provider introduction to Paragon Clinician Hub.